Welcome everybody. Guess who I have here? My best friend forever. I found this model in Amazon actually. And when you go and my producer said, I found your models for the program. I said, oh my God, to start the show in January, we have 6 months already. We are gonna record season 3 and this is the reason why I am telling you, welcome back and thank you so much to every one of you for subscribing to the channel, for liking the episodes, for all the good comments, the bad comments to make me better, because I love any comment that you can give me. But anyway, from that, the majority of people watching it has been very grateful. All my friends in Mexico give me a very good feedback of the program, how much they have learned. Why? Because my mission in this program, my passion is to help people to avoid dental problems, to avoid going to the dentist that much. And if you break a tooth, okay, it was an accident, for that reason you are at the doctor's office, but not because you didn't brush well, you didn't floss well. And that's the reason on the season 1, I have the brushing technique that has worked for me the best. It's an amazing technique. I tell everyone, Dr. Chisikowski from Mexico City taught me that technique and it's the best. And I taught the patients how to place the brush between the gum and the tooth, and how important it was 9 times for this side and 6 times down, like scooping down. 9, everything, angulation of the brush between the gum and the tooth, everything is specific said in that episode number 2. I told them what the brush has to be soft, that you cannot do hard brushing. What that means, if you come to my chair, it's because you need a root canal. But before being an endodontics, and I have 2 specialties, one that I was dedicated, and I did it in Mexico City, and I was from 83 to 92, I don't want to say anymore. But when I went to USC, I wanted to learn surgery, and I did. I did microscopic surgery, and with that I learned how many people do not know how to brush. And I dedicated to teach all my patients. I was criticized at USC because why I'm teaching my patients to take care of their teeth. Because for me, it's so important that you follow the technique I gave in episode 2, and I guarantee you that you will not have dental problems if you follow every step I'm giving in that technique. I also teach you guys that you have to brush the tongue, because on the 3rd season, we're gonna talk about the bad breath, which is like really like people that in the morning wake up and just talking, they even smell their own bad breath. We're gonna talk about can be caused by a liver problem, kidney problem, or some patients, the majority, they don't brush their tongue, or they have a cavity somewhere in the mouth, like we have this model that they never saw. They never saw they were gonna have this cavity. And the cavity went to the nerve, and from the nerve goes to be an infection at the end. So if you wanna avoid any problems here, you gotta brush and floss every single day. So I taught how to avoid to have a cavity, and I also, in the season 2, and it's also season 3, how do you detect you have a caries? How do you know you have a cavity? I give 3, 4, 5 tips that if you follow them, you know. And then also you have a bad smell. You have a bad smell because you didn't brush on the top. Also, if you don't brush and floss, what is gonna happen? I love my models from Amazon. What is gonna happen? The bone, this is the bone, then you're gonna start losing the bone. See, I cannot see here, but if this is the bone, right? So now the bone is gonna be destroyed. You're gonna look at your mouth here with your gums, and you're gonna see the space here. And all the space that you have in these areas is because you don't floss and brush, believe it or not, correctly. People sometimes brush 3 times a day, 4, but they don't have the right technique. If you don't have the right technique, you have to watch the episode number 2, because you're gonna have it. I also talk about people that grind their teeth, clench your teeth, how it's so important that you're gonna use this NiGuard. And the NiGuard is a device that your dentist will do. They have to adjust it Some patients said, well, they did my Niagara, but I was never able to use it because I got nauseated. Then you have to tell your dentist to reduce on the back, to reduce a little bit to the point that all your teeth have to be protected. If you don't protect your teeth or your crown that you did, I'm gonna tell you about how do you take care of your restorations after the treatment, how do you take care of a root canal after the treatment. So if you don't do that, and you don't cover with a Niagara and you're clenching and grinding your teeth, they're gonna fracture again, even if it's the best crown on the world that it was made. And also, if you don't check with your brushing, also I talk about root canals. How to avoid a root canal. How do you know that you need a root canal and what to expect when you're gonna have a root canal. We're gonna present the patient that we're gonna talk about the root canal, and then we're gonna talk about why it's important that she has a good dentist, that she has a good crown on top, and then 10 years later, 15 years later, we can see that the tooth is completely successful. I have treatments like that I showing through the process of different seasons where I talk about endodontics. We're gonna talk, and guess what? Another topic very interesting is the anesthetic. The anesthetic is lidocaine, xylocaine, whatever name it is. This anesthetic that has the red here is because it has epinephrine. Epinephrine is a solution, it's a vasoconstrictor solution that is gonna make the anesthetic to last longer. But I want you to memorize epinephrine, because if you have a high blood pressure and you're not controlled, you don't take medication and your blood pressure is a little high, it's better to don't use epinephrine. I don't use epinephrine with patients with high blood pressure that is not very well controlled, or the high blood pressure is still high even with medications, or patients that are extremely anxious. The anesthetic, I show also with the syringe how slow they have to place it, because when you put a syringe or a needle in this area, if you go very slow, guess what? The patient is not gonna feel it. When you pull the lead, the patient is not gonna feel it. The develop the needle up, the patient is not gonna feel it. And it has to be so slow that we're gonna place drop by drop of this anesthetic until we finish. If we stay for a long time with the patient, in a few minutes, the anesthetic, when we finish, the patient is numb. And I put the topic anesthetic like 15, 20 minutes. My patients here are very, very personalized. Everyone has enough time for treatment. I take care of anxiety patients, but in this office you will never see a line waiting, because I only see 4 patients in a day, to have a space for emergency. Depending on the patient, I schedule the amount of hours, and I don't charge per hour. But I'm telling you this because it's important that you ask your dentist to have the time for you and be sitting with you during your treatment to ask questions. What I can expect of this treatment I'm gonna have? What is gonna happen after I have a crown? You need to know that your crown needs to be fitting perfect to the point that you can bite very well. Not fitting like that's the first one to touch and it's high. No, it has to be fitted very well. You have to be sure that you don't have to do any movement to correct your bite. You need to be able to have a good crown adjusted, and that is not high at all, because I have a patient that contacted me from Mexico. It's a friend of a friend. I don't know her personally, but she's adorable, and asked me if it was normal her crown was hurting after a year. No, it's not normal. So in all this teaching that I'm gonna give you, in all these topics, we're gonna talk about the Sjögren syndrome, which is about the mouth that is very dry. We're gonna talk about implants. We're gonna talk about how do you prepare yourself for a root canal? How do you prepare yourself after the root canal? What do I do after the root canal? How many weeks is gonna be hurting? How do I take care of my dry mouth, or patients in the third part of their lives after 65, 70, that now is even older? They have to know why the mouth gets dry, etc. All of that we're gonna talk about so many good topics that you are gonna be happy to learn how to avoid dental problems. And I'm grateful again to all of you, the subscribers. Recommend your friends. My producer, that we have better production with 2 cameras, more lighting, etc. We have more models to teach you more things. So stay put. We're gonna talk about many topics that you're gonna love. Thank you. Bye bye.